Hello again. Something very strange is that despite the fact that the National Health Service in Britain is collapsing beneath the weight of its own contradictions, and that we are all well aware that it's on its last legs, nobody dares say the obvious, that it has failed in the most spectacular fashion imaginable and needs to be replaced by another, less expensive and more efficient system. This is one of those things which we all admit privately to ourselves, but none of us wants to say out loud. We know that we can no longer see a doctor or get a hospital appointment. We know that the casualty departments and the ambulance system are absolutely atrocious and getting worse. But we desperately go on hoping and making excuses, thinking perhaps that the thing will mend itself if only we throw more money at it. It will not. I'm aware that a lot of people here disapprove of vaccines, but the ease with which patients can get a flu jab with the NHS or through a private contractor is quite astounding. Both are free because pharmacies are used as partners, but it's a difference in the experience that people find simply amazing. Booking a flu jab with a GP can mean ringing up a dozen times until one gets through, and then being told that you must come and be treated like a beggar, soliciting alms, as though they're doing one a favour. You'll be told the exact time that you've been allocated. Most chemists, on the other hand, who are working now in partnership providing this service, have a walk-in thing where people simply turn up and the chances are they'll be given the vaccination on the spot at once. This then is privatisation in practice. It works, and it's a damn sight better than the service offered at a doctor's surgery or hospital. Monolithic government organisations which have a virtual monopoly on some vital service seldom work very well. This is especially so for those which are run from one place and expected to be sensitive to the needs of citizens who live hundreds of miles away at the other end of the country. How could they be any use? What can some civil servant in London possibly understand about the needs of people living in a remote village in the Scottish Highlands? This is the problem with national services. I wonder how many people remember when Britain's General Post Office had a monopoly on telephones in this country. The days when one had to go to a government office and be interviewed in person if you wanted a telephone. And even then there'd be a 4-month wait before a state employee would come round and install it. Seriously. That's how the national telephone system worked. It was appalling. Or the days when gas cookers were a government monopoly and you could only fit a cooker supplied and approved of by the state. But don't take my word for it. Ask yourself why the survival rates for 9 out of 10 common cancers are worse in this country than the European average. Hint, we have a national health service, and most other countries have realised that this is a really bad idea. The problem is, as I say, we all know this, but nobody wants to be the first to say it. Instead, we'll go on tinkering with the system and watching it get worse and worse until it finally falls to pieces and leaves us without any health care at all.